Hi, this is Sean Bugg, broker owner of Strive Realty. Today we are with Dr. David Capper, Department Chair of Clinical Sciences at TCU and UNT HSC School of Medicine. Thank you so much for joining us.
So glad to be here.
Well, today we're going to talk about what everybody else says, the coronavirus. So Dr. Capper, can you kind of give us a little bit more about what you know and what you're hearing in the medical field about the coronavirus?
Yeah, it's a very dynamic time. Things change daily. And as you all know, you all are reading, you all are listening to radio and watching television. Things are changing daily. It is very dynamic. What do we know the most about the coronavirus, though, that is of justified concern is that it's highly infectious. And I think that's the important thing for us to appreciate, how infectious this virus is. So by being so infectious, the measures that the public health entities and governments have taken seem alarming, but because of the seriousness, it's appropriate. Closing schools, stopping sporting events, any event that people would be gathered in a high concentration in a smaller area, those are the types of things that we should avoid at this point.
Okay, great. So Tarrant County, Dallas County, DFW Metroplex, should people live in fear?
No, we absolutely shouldn't live in fear. COVID-19 is a pandemic, but it's not a panic. It begs for us to be serious and as knowledgeable as we can and function out of reason, but not out of fear. We have, let me come back to Dallas-Fort Worth in a minute,
yeah.
but let me talk a little bit about, this was a beautiful article in the Wall Street Journal just published last weekend. What we can learn from the 20th century's deadliest pandemic, the Spanish flu of 1918 that killed 50 to 60 million people worldwide. It was highly infectious, but what we learned the most from that was the communities that took measures like what we're seeing happening now with closing of schools and whatnot, versus those that didn't. Those communities that took public health measures into effect actually had a significant reduction in the number of people who were affected by the flu. That's what we're trying to replicate again now, not to have such high transmission among our populace.
Awesome. So small group gatherings versus we're seeing obviously from federal, state, local, no meetings over 500 people, they're shutting down sporting events. What does that look like from everyday living and hanging out with friends in small group settings or showing houses or going on appointments for your average work life?
Okay, so this is where there is a pretty varying differences of opinion. On the one hand, some people say that we should all self-quarantine and just hunker down in our homes until this thing passes by. There are others who say, no, until that virus starts to spread in a community, we don't need to be that aggressive about self-quarantine. People who are at risk should self-quarantine. There's no question. Who's at risk? The very elderly, the frail elderly, and the frail. Who's frail? Frail is people who have underlying diseases or immunocompromised people. They need to be very, very cautious. What about the rest of us? This virus doesn't kill young people. For the most part, young people are going to make it through this virus. We don't want to get it, but it's not going to be the same seriousness that it is for people who are frail or elderly. So we need to be smart. We need to not put ourselves in a position where we can get the virus and expose those who are at risk. But if we are the ones at risk, we need to really be quarantining on an everyday basis. We've got to live our lives still. We need to do things that are reasonable. That means we need to be able to conduct business and just maintain some degree of sensible social distancing. Right now, you and I are 2.5 feet head to head. Well, if we move back and achieve 6 feet on a constant basis, that actually is smart. We need to wash our hands. We need to do things that are sensible. Places of business in our homes, we need to keep our counters and surfaces clean. Of course, those are reasonable things to do, and that's what we should do. But not to conduct business, I think if we are sensible, people are not going to come in if they're sick. People are going to be aware of whether they have symptoms or not. running fevers. And then I think it's justified for businesses to ask people if they're ill or running fevers or they have any symptoms to please stay away at this point, but not people who are not sick.
Awesome. One final question. Where would people get the most up-to-date information to stay constant with what's going on in the world today?
The CDC has done a wonderful job of educating the public. They update their information almost a couple times a day, and I would suggest that everybody just pay attention to what the CDC is saying. They've been very transparent and continue to do so, and that's the best source.
Awesome. Well, thank you so much for being here today with us. We're not going to live in fear, and we're going to continue to sell properties here in the DFW Metroplex. We hope you have a wonderful day. Stay safe and wash your hands.